Hello everyone. In this video demonstration, we will be discussing about cavity preparation for a glass ionomer cement restoration, manipulation of glass ionomer cement, and finally filling the cavity with glass ionomer cement. Glass ionomer cement was first introduced by Wilson and Kent in 1972. It is so called because the powder contains aluminosilicate glass and the liquid contains an ionomer of polyacrylic acid. Glass ionomer cement is especially advantageous in primary teeth because it chemically bonds to the tooth and also releases fluoride. There are 9 types of glass ionomer cements. Type 1 luting GIC, Type 2 restorative GIC, Type 3 liners and bases, Type 4 for pit and fissure sealants, Type 5 orthodontic cements, Type 6 core buildup, Type 7 high fluoride releasing, Type 8 atraumatic restorative treatment, and Type 9 pediatric GIC. Today we will be preparing a cavity in a primary molar for a type 2 restorative GIC. Now the cavity for a glass ionomer cement may be conservative. It has to be limited only to the carious part of the tooth and no additional retention will be required since this material bonds chemically to the tooth structure. For preparing the cavity, we will need an air rotor, a small round burr, a straight burr, and a diagnostic set, that is a mouth mirror, an explorer, and a tweezer. I will be using a round burr for making the initial depth of the cavity. I am using a round burr to enter into the cavity and create an initial ditch. The cavity here was limited to the occlusal pit. We can now use a straight burr so as to widen the cavity. So now you can appreciate that a conservative cavity has been prepared for filling it with glass ionomer restorative cement. All the carious tooth structure has been removed. If in case any additional carious tooth structure remains, then we may use a spoon excavator to remove it from the deeper depth of the cavity. The material which we will be using here is type 2 glass ionomer cement. The powder contains alumina, silica, aluminium fluoride, calcium fluoride, sodium fluoride, aluminum phosphate, cryolites, and barium oxide. The liquid contains a copolymer of polyacrylic acid with itaconic acid, malic acid, tricarboxylic acid, tartaric acid, and water. For manipulation of glass ionomer cement, the powder and liquid are taken in a ratio of 3:1. That is 1 scoop of powder and 1 drop of liquid. So here I am dispensing 1 scoop of powder. I will level the scoop with the plastic insert provided on the inner side of the bottle. That is 3 times the quantity of powder to 1 drop of liquid. For manipulation of GIC, the powder has to be divided into 2 equal increments. The first increment has to be incorporated rapidly into the liquid using round circular motions. Now the second increment has to be incorporated into the liquid using a swiping and folding technique. The swiping and folding technique helps in proper manipulation of GIC and in the formation of a gel-like structure. So we have to swipe and fold the mix in order to get a proper glossy surface of the final mix. The final mix should be viscous and in a packable consistency. Restoring the cavity with GIC. In order to restore the cavity with GIC, we have to first wash it and then air dry it. The cavity should be isolated using cotton rolls. Now use a plastic filling instrument to carry the GIC mix into the cavity. Then you can use a packing instrument to pack the GIC mix into the walls of the cavity. Coat Vaseline on your forefinger and apply pressure onto the GIC. This way, it firmly secures into all the confines of the cavity walls. A diamond carver may be used to remove any excess filling material. And apply a final coat of Vaseline or white petroleum jelly. You may also use an articulating paper to check for any high points and remove them using a small round burr or a diamond carver. So the initial set of GIC restoration is 7 minutes from the start of mixing and the final set is 24 hours from the start of mixing. GIC sets by a reaction between the glass particles of the powder and the liquid. There is formation of calcium polysols and aluminium polysols. When the powder is exposed to the liquid, there is leaching out of ions like calcium, aluminium, fluoride, silica, and sodium. These ions react with polyacrylic acid to form polysols. Calcium polysols are formed first and later aluminium polysols are formed and are responsible for the final set. The set matrix consists of unreacted glass particles surrounded by silica gel in an amorphous matrix of hydrated calcium and aluminium polysols. GIC chemically binds to the tooth by reaction of carboxyl ions from the polyacrylic acid to the calcium ions of hydroxyapatite crystals of enamel. Post-operative instructions for a GIC restoration are that the patient should avoid exposing the restoration to any masticatory stress for 1 hour and only soft diet should be consumed for the next 24 hours. Thank you.